somewhere far from the patient. The patient is at home, we are in the hospital, we're able to see that information. So what are some of the professions that are currently working in the Mayo Clinic Virtual Hospital? Well, we have the scheduling team. Those are obviously the people that schedule the virtual appointments. We have the receptionists or desk operations specialists who work, who help check in patients when they come in, either for their in-person appointments or when they dial in for their virtual appointments. We have the patient online services staff. These are the people who help keep the patient portal platform going. So patients have the online account where they're able to log in and see their health information, whether it's lab tests, imaging studies, their recent hospitalization course. They're able to see their upcoming medical appointments. And so these are all the staff that help keep that platform functioning so that patients are able to go in and view that information. Nurses work in the virtual hospital. We'll talk more about that. Nurse practitioners like myself work in that space. Physician assistants or associates work, and as well as physicians also work there. Some professions that I listed here who indirectly work with virtual hospital, meaning they maybe don't have direct interactions with the patients, but are very much a huge part of the team that keeps these platforms going and functioning and doing what they're supposed to be doing, are people like data analytics staff. So these are the staff who review all of the data that is captured from all of the virtual visits that we do, and how can we use that data? We can use that data to improve the quality of the services that we provide virtually. We can use that data to look at outcomes for the patients who are getting virtual care, their health outcomes. Are patients doing well at home? Is this the right, model of care for that particular patient? So there's a lot of ways to look at that data that we are collecting or that gets automatically captured by just this digital footprint. And so the data analytics staff are very, very integral in making those numbers and data make sense. There are administrators and operations managers who are obviously integral to the operational side of virtual hospitals. And then we have the business analysts, revenue, compliance, finance specialists who do all of the numbers. So looking at how can we lower costs using virtual hospitals? How can we, decrease emergency department visits or hospitalizations and all of those things? And then we have the clinical systems educators. They are very, very important in not only educating staff about just the different systems that we have, but also patients. So for instance, now with the wide use of virtual hospitals or telemedicine, telehealth, patients are just kind of starting to adopt these different models of care. And so these clinical systems educators are very helpful in creating like pamphlets for patients to look at and one-page papers for them to like quickly read about what virtual care is or what remote patient monitoring is. And so just very important people. And then we have billing and documentation specialists who help with kind of paperwork behind the scenes, making sure that we're billing appropriately for these virtual visits that we're doing. Then we have case managers who are social workers, who are like social workers and can point out to these different resources, virtual resources for patients when they are being discharged from the hospital or if they're going home from the clinic after seeing different people at the clinic. So diving kind of deeper into the nurse's role within the Mayo Clinic Virtual Hospital. So in the outpatient setting, nurses mostly conduct video and telephone visits with patients based on patient queries submitted through the portal. So sometimes patients might have questions about their recent appointment that they just had, or they might have questions about their recent hospitalization they had, or they might just not be feeling well. They woke up one day and they're just not feeling well. They might call their primary doctor or provider, and depending on what the reason for the call is, if it's not a kind of a high risk issue, a nurse might end up just doing that telephone or video call with the patient and then triage from there, depending on what comes out of that conversation. In the inpatient setting, we have virtual registered nurses. We call them the VERNs. They are just so helpful. They collaborate with bedside nurses and assist with intakes and admissions and care oversight and discharges. So when patients get admitted to the hospital, there's always so much paperwork to do and updating their health records and asking them all of the screening questions. And so the VERNs can really help the bedside nurses do all of that initial screening with admissions, for example, so that the bedside nurses can take care of other patients. And so the bedside nurses are able to then care for more patients because these VERNs are able to help with things like admissions and discharges. And then for the care oversight, this is when like a patient is deteriorating, maybe on the general care floor. Some of the ICU nurses, we call them the EICU nurses, can actually remote in through the screens and brainstorm with the bedside nurse about what could potentially be going on and how can they maybe, what else can they look into as this patient is deteriorating, or how can we all collaborate? How can the nurses collaborate with the care teams, the providers, the clinicians that are in the hospital to take care of this patient so that the patient doesn't deteriorate any further? So they're very, very critical in just helping with a lot of the things that the bedside nurses do. And so they're supplementing some of that work for the bedside nurses. There's also capabilities with technology called Caregility and iObserver. And I will show you, I think it's on the next slide, how this looks like. But it's really, you're able to monitor patients in real time. So you're able to remote into their rooms and you're able to monitor them in real time. And this works really well for patients who are, fall risks, patients who are confused or delirious and agitated, some of the patients who might be admitted with psychiatric medical conditions who you're just maybe worried that they might get agitated and would want to keep a closer eye on them. You can actually use these to look into the room and see what the patient is doing. So you can tell if they're sleeping or if they're agitated and pacing around the room. So it's very helpful. Another way that nurses are used in the inpatient setting, especially this is usually in the emergency department, is the telesane nurse. These are nurses who are trained in sexual assault exams. So we can have a nurse in one emergency department, and if there's a patient in another emergency department who comes in with concerns for sexual assault, that nurse can actually virtually connect with that patient in a different emergency department into the patient's room and actually start all of that work that has to do with kind of sexual assault concerns. And then in the transitional care space, nurses are able to monitor the dashboards for all of the different remote patient monitoring programs. So a lot of the specialties, including my own area of work, gastrointestinal medicine, we have our own remote patient monitoring programs. And so when patients get seen by all of these different specialty services, like the heart doctors, the lung doctors, pediatrics, the kidney doctors, the cancer doctors, they might send the patients home with devices, the remote patient monitoring devices that capture metrics that we can then look at and determine what the next steps would be for that patient. So the nurses actually are the ones who are monitoring those dashboards. And if there are any concerning findings in terms of vital signs or any data that's coming through to the dashboard from the devices, they're able to reach out to the specific specialty that ordered that remote patient monitoring, and then that specialty is able to get orders in or kind of direct the next steps for the care of that patient. And then sometimes nurses also do visits for medication reconciliation and post-discharge follow-up. So when patients go home from the hospital, nurses might, maybe 2 or 3 days after discharge, they might do a telephone or video visit to just make sure that their medications are exactly how they were prescribed, and then also just to see how they're feeling after being in the hospital. So this is an example of the screen that we are starting to have now. Instead of tablets in the patient's rooms, we are having these screens. And so this is where the nurses pop up, and sometimes that can startle the patient. But the nurses just pops up, appears, and starts to talk to the patient. So you have to be careful how you do that sometimes, because it can really startle patients. But this is how they interact with the patients. And this is just an example of how we would see into a patient's room when we remote in and are trying to just observe what they're doing, what the patients are doing. This is an example of what we would see from our screens wherever we're watching from, right here. So how does interprofessional work in a virtual hospital look like? This is a very general workflow for virtual appointments. So first, whether a patient is seeing in the emergency department or the outpatient clinic or any other kind of care setting by like a specialty provider or their primary care provider, the care teams decide if a virtual appointment is needed. After that, the scheduling team will schedule the appointment. The patient is able to see that appointment in their portal, so their online account. And then when the date and time comes for the appointment, the patient will dial in for the appointment virtually, connect virtually. The check-in staff will room the patient. So you are rooming them virtually. They're not there in person. You are rooming them virtually. And then the check-in staff will notify the provider that the patient is ready to be seen for their appointment. That appointment will be completed, whether that's by a nurse or a nurse practitioner or physician associate or a physician. The appointment will get completed. Then the documentation gets done, and we have templates for that. So you complete the documentation, and then you submit that for billing. So that's a very kind of basic workflow of these appointments. So how do virtual hospitals benefit patients? Well, first and foremost, and probably one of the most important things, is increased accessibility. We all know that some patients, especially in remote areas and rural areas, really don't have, either insurance or transportation or health literacy to able to access healthcare services. And so it's really nice sometimes to be able to reach those remote populations and be able to provide services for them, and then they don't have to worry about transportation, which kind of leads into the next point here about reduced travel time. So again, not everybody has reliable transportation. And so if you're able to meet patients where they're at, which is usually their home environment, it really can enhance convenience and efficiency and satisfaction for patients. Virtual appointments are generally lower cost than in-person appointments, and which can make healthcare more affordable. And then it's a very comfortable environment. They're in their home. They're in an environment where they are relaxed and familiar with. And so this can really enhance communication. It can help them open up more, especially